So, Dr. Mercola, thank you so much for joining me today.
Well, it's great to be here. Great to have you over here, actually.
Yeah. So, you've been doing a NES Health program for about 2 months. Can you tell me your experience on the program?
Well, I'm enamored with the concept. I've been using energy medicine treatments now for probably, or aware of them for over 20 years, 25 years. And I purchased a number of units in that process, in that time, maybe about half a dozen or so. And units are typically $10,000 or more, in that range. And was impressed with the process, but I mean, impressed with the systems, and I received results, or the patients received results, but it was difficult to implement, and it's tedious, and many times it took a long time to make an assessment, but I've been beyond impressed with the simplicity of the NES and the fact that you can make an assessment within seconds, literally seconds, which is, orders of magnitudes faster than any other system I've seen. And the benefit that you can actually use the My Health system once you have it as a treatment device too, because it's a PMF treatment. So it's incredible that way. I have always been interested in health, or at least in my adult life, and been seeking to focus things. So I've got a pretty good health program. It's optimized my diet, and I haven't yet really noticed any big changes, but I'm confident. I have a few subtle health challenges that I'm hoping that will make a difference with this. And I guess I'll know after a while. And I'm actually seeing you for the detox, so I'm using, just now I've got some special extra folders that aren't typically available, but that facilitate the detox, that help with specific metals that can help eliminate them. So.
And when we did your NES Health scan, you had a couple things come up in the scan that are known health issues for you, correct?
Oh yes, yeah. It was interesting, yeah.
Yeah, and I find that's a common experience that people
it confirms
have a physical health issue and they'll have an energetic block that they see in the scan.
Yeah. So, there is one component that was a bit of a, it's hard to, I do so many things at once. I don't isolate variables, so it's difficult to pinpoint them.
Yeah.
But I had an electrical issue with my heart, a conductivity issue. And it was one of the things that came up on the NES. But then I've also realized that EMF exposure is a particularly pernicious toxin for this, because it hits these voltage-gated calcium channels in the highest densities. So one of the highest density bodies is in the pacemaker node of the heart. So, it's pretty wise to address that to address the cause. And NES Health it's interesting in that it doesn't really tell you, it's not a diagnostic space, you get this disease. It really just suggests these informational pathways that contribute to the pathology of the disease that we label. So it's beneficial from that perspective, but it doesn't really give you a diagnosis, but it tells you a system that's out, and that can contribute. Sometimes it aligns with what your actual issue is, because it's, they're the same, but it's, it's these supporting pathways that all contribute to it that really address the cause. So it's doing a magnificent job of addressing the informational energetic component of health.
And so you've been using a My Health device, and so what have your experience has been with that?
It's very easy to use. I'm just saddened that I wasn't aware that there was a protective bumper that you can put on it, like, hey, you can for your cell phone, because they're pricey devices, so you want to protect them, and I would encourage anyone that's considering that to have a bumper on it, because I broke mine. So, other than that, it's very easy to use. I use it when I travel. I use it in airplane protection mode, and I just learned even better ways to do it when I travel, because there's an exposure that you can do. We're looking at using molecular hydrogen tablets that provide a source of antioxidants to address the free radicals. The hydroxyl free radical that gets generated when you're flying at 35,000 feet. So, but I use the My Health for that, and I use the hydrogen, and I think I'm pretty well insulated, because that is a challenge. I mean, thankfully we have the convenience and the ability to travel easily and efficiently and quickly, but it's at a risk, and most people are relatively clueless as to the risk they're engaging themselves in by participating in that. And I fly at least once a month, and many months much more frequently than that. And I live not in near a major airport, so I always have to take a connecting flight, which adds on some more flight time. So I'm very grateful that I have that. I feel mentally reassured that I can turn that on. It's so simple. It fits in. I'm a male, obviously, and I have large pockets, so some women it may be a problem, but you can put in your purse. It's a little bit bigger than a cell phone, but not much.
And so have you ever done a spinal scrub before? I think we're gonna have to do a spinal scrub on you before we leave.
I think we did. We did the spinal scrub.
No, it's a different technique. It's a spinal scrub. I'll show you what it is.
Okay.
Because it completely energizes you. You can really feel the difference after we've done it on you. It brings all the energy up your spine.
I really am very grateful. I first learned of your work when Ben Greenfield interviewed you, and I said, "Oh, that's intriguing." You have to be skeptical. Initially, I think anyone exposed to this should be skeptical, and I've been exposed to this for a long time, and I was skeptical when I listened to you. But then I looked at your work and watched a bunch of your other interviews, and I said, "Wow, there's probably something to this." So enough to explore it, and I was so glad I did, because I was just really, I really think there's enormous potential here, and I'm also delighted that you personally and NES Health specifically are in the process of developing resources that will make this technology widely available to the public, because it gets to be a challenge. Even with these other energy medicine devices, you had to travel to find a clinician. You had to physically be there in person, and you don't have to do that with NES. You could easily do it. Literally it's seconds, and so you're creating this network of trained clinicians who can guide people through the process, and not only just address the NES and the detox, because health is obviously much more, and the dietary foods component, lifestyle is a big issue, and EMF, which I have to talk to you about after we finish this interview. But I think integrating the EMF into what you're doing with NES and your detox program would be a very useful strategy, because they're so highly synergistic and profoundly. When you get both of them together, it's like, whoa. We're talking about life-changing events here, and I'm just, I hate to beat the bush again, but I'm just so passionate about and concerned about the exponential increase in the exposure to the microwave radiation you have. That's going to it is impairing it, and I believe is a major variable and a contributing variable to the epidemic of so many diseases that we have.
I 100% agree with you, and it's dramatically affected my health as well. And now that I'm taking precautions, I feel so much better.
Yeah.
And I love that you're so passionate about EMF and using the My Health device to protect your body from EMF when you travel. And there's also settings for microwave radiation, for computer radiation, for cell phone radiation. I think those are one component of helping to protect your body from EMF. Have you used any of the other settings on the My Health for EMF protection?
Well, I don't. I hadn't thought about using it as a cell phone, but it's interesting. Cell phone and microwave radiations are almost the same frequencies, so I still don't. I'm not quite certain what the differential is at. Because microwave oven, anyone watching this should not be using a microwave oven. No. There's just no reason for it. Because you think the levels are high from your phone, but they're literally 10 to 100 times higher from a microwave oven. And especially if you're standing near it, like a few feet away, you are just blasting the heck out of your mitochondria. There's just no reason for it. So get rid of it and just replace it with a steam convection oven. Or a steam oven or a convection oven. But it would just do not use a microwave. There's just no reason you should have it.
Well, Dr. Mercola, thank you so much for
joining me. Well, thank you, Wendy, for all your
me.
help. You're really providing so much benefit to so many people, so thank you for everything you're doing.
Thank you, and I've admired your work for so long, and reading on your site and so many insights that surprised me and just really blew my mind. It got me so interested and passionate about health. You really lit that spark in me to learn more about health. Because I had always read about conventional mainstream medical breakthroughs and reading Scientific American, the latest drugs.
Yeah.
But when my father died of cancer, and I was, reading, I've been reading on your website for years about, natural ways to address your health and the dangers of a lot of drugs that are routinely given to millions of people. You really helped me get much more passionate and focused about how I wanted to help other people as well. So thank you for that.
Well, you're welcome. But that was by design. That was our intention to, really catalyze the transformation in the system that's killing so many people needlessly.